Rahim. I am Dr. Muhibbullah Wazir. The topic for today is clavicle. Look, this is the clavicle bone. This. Note the point that the clavicle is a long bone which lies horizontally. The clavicle is a long bone which is the first in the body to start ossification. The clavicle is a long bone which develops partially in membrane and also in cartilage. Developmentally is mostly membranous and also some part is cartilaginous. Now this long bone, you look over here, it lies over here at the boundary line between the neck, posterior triangle of neck, and the thorax, and medially you can see it articulate with the sternum, and laterally you follow it articulate with the acromion process of the scapula. And note the point that the bone at the top of the shoulder, this bone at the top of the shoulder you feel, this is the acromion process. Note also this point that it is only the clavicle that articulate the whole upper limb with the axial skeleton. That is, the humerus articulates with the scapula, and the acromion process of the scapula articulate with the clavicle, and the clavicle articulate with the sternum. In this way, the weight of the upper limb is suspended or being connected to the axial skeleton only through the clavicle. And it is because of the same reason that if you lift a weight, the weight from the upper limb is ultimately being transmitted to the axial skeleton through the clavicle. And it is also because of the same reason that when you fall at an outstretched hand, the heat is being transmitted to the clavicle, and usually the fracture of the clavicle occurs because of this indirect violence from the hand through the forearm and on, and then to the clavicle. Okay, now look at the clavicle. It has the medial end and the lateral end. And look, the clavicle is having the medial rounded end and the lateral flattened end. That is acromial end and that is sternal end. First, these 2 parts, rounded medial and flat lateral. Secondly, the clavicle lies in a way, it is a curve, it is a gentle curve like that in the medial part it is convex anteriorly, and in the lateral part it is concave anteriorly. You can feel it overhead in your own that this part is convex while the lateral part it is concave. These 2 facts, number 1 that the 2 ends, and number 2 the curve. And thirdly, on the inferior surface of the clavicle, there is a groove on the inferior surface of the clavicle. This one, this is subclavius groove. In this way, you come to know medial end, lateral end, and 2 curves, anterior convex and interior concave in the lateral, and then because of this subclavius groove you identify the inferior surface, and then automatically this is the superior surface. Now take the bone and keep it in any side. Let us say we keep it on this side. Yes, this is the medial end, this is the lateral end, convex forward and concave forward, true. But look, the inferior surface is coming superiorly, so it is not the right bone. Now bring it to the left side. Again, the medial end and the lateral end, the convexity and the concavity, and this inferior surface now coming inferiorly. So this is the left clavicle. Identification of the site. Okay. Now you look at the medial end. The medial end is strong and it is rounded and having an articular facet on it, and this articular facet, it is for articulation with the same articular facet on the upper part of manubrium of the sternum and manubrioclavicular joint, a sternoclavicular joint. But note the point that some part of this articular surface is being occupied by the manubrium, but the highest part remains out of that. And over here, the ligament which connects the two clavicles with one another, interclavicular ligament, is being attached over here. So this surface is for articulation with the sternoclavicular joint, with the articular surface and the manubrium of the sternum, and over here the one ligament connect the two clavicles with one another, that is interclavicular ligament. Then you look over here, this medial part or medial two-third of the clavicle, the medial two-third of the clavicle, it is somewhat rounded, but even then it is having this superior surface and this inferior surface, this anterior surface and this posterior surface, but not very clearly demarcated from one another by any margin. But over here, this surface in lower surface, anterior and posterior. And now you look over here. Which one is this muscle? Pectoralis major. Which one is this muscle? Deltoid. And this muscle which you can see over here in your own neck over here, this is sternocleidomastoid. And this muscle you see over here, this one, this is trapezius. Now look to this medial part. Over here, you can see to the anterior surface of the medial part, there is attachment of pectoralis major. And to this upper surface, you can see there is attachment of sternocleidomastoid muscle. And then on the inferior surface over here, you can see in this subclavius groove, you see this subclavius muscle is attached. So over here, the muscle attached from the anterior surface, the pectoralis major, and on the inferior surface, the subclavius, and at the medial end, over here from above, coming the sternocleidomastoid muscle. Alright. Then coming to the lateral third, you see it is slightly flattened out and having this upper surface and lower surface separated from one another by this anterior border and this posterior border. And look, this upper surface is comparatively, you can see it is flat, and you can see this hole is being occupied by this trapezius muscle. To the lateral third, upper surface is the attachment of trapezius, and to the lower border you can see there is the attachment of the anterior fibers of deltoid. You can see. So in this way, over here there is the attachment of trapezius muscle, and over here there is the attachment of anterior fibers of deltoid, and over here there is the pectoralis major, and in this area over here there is attachment of sternocleidomastoid muscle. Then you look at the inferior surface. Number one, you can see this groove, and lying in this groove, is the subclavius muscle, and to the margins of the subclavius groove there is the attachment of the two slips of clavipectoral fascia which encloses the subclavius muscle. And then At the inferior surface of the lateral part, you can see this tubercle, very clear cut this tubercle. And this tubercle which you see over here, this is conoid tubercle, and this ridge which extends laterally from this conoid tubercle, this is trapezoid loin. This is the conoid tubercle, this is trapezoid line, and attached over here is the coracoclavicular ligament, and the one part of coracoclavicular ligament which is attached to the conoid tubercle, that is being called as conoid part, and that part which is attached to the trapezoid line, that is called as trapezoid part. I will show you these ligaments. Alright, or you look at this part. Now you can see over here, you can see, look, this is coracoid process of the scapula, okay, and over here, this rounded elevation, this is the conoid tubercle, it is the conoid part of coracoclavicular ligament, and over here this is the trapezoid ridge or trapezoid part of the coracoclavicular ligament, combinedly that is coracoclavicular ligament, conoid part and trapezoid part. Okay, and then over here on the inferior surface, you would also be able to see the nutrient foramina, but it is being colored, that's why it is not being clear, but you would be able to see the nutrient foramina. And then at the lateral end, at the acromial end, you can see this articular facet. This articular facet, it is for articulation with the articular facet on the medial surface of this acromial process to form the acromioclavicular joint. And over here, look, this is the acromioclavicular joint, and from this coracoid process over here, there are the two slips of the coracoclavicular ligament, that is the conoid part and trapezoid part. Okay, and this is the coracoid process. All right, the nutrient foramen. Now note another part, and now you can see over here. Look again, just look, this is the sternum, and this is the sternal end of the clavicle. You can see that the upper part of the medial end of the sternum is not occupied by the menobrial, that's why the upper part is above this cavity. Secondly, you look, the structures coming from the cervical region, you can see over here, these are the roots of the brachial plexus, and then 1, 2, 3 trunks of the brachial plexus, and then division of the brachial plexus which lies behind the clavicle, and then below the clavicle in the axilla, you can see this is the medial cord, this is the lateral cord, this is the axillary artery, posterior to the axillary artery is the posterior cord, which we can't see, and then medial to that all over here lies the axillary vein. So these structures passes behind the clavicle, okay, to enter into the axilla. All right, then the clavicle over here, you know, it is being crossed by the three supraclavicular nerves, medial, intermediate, and lateral supraclavicular nerves. These nerves also supply the periosteum of the clavicle. Now the clavicle is usually being fractured over here, and that is usually from the indirect wireless coming from the while filing at the outstretched hand. And if there is fracture of the clavicle, note the point that the subclavius over here, it plays the part that the two fracture ends of the clavicle not to injure the underlying structures. Over here, you already know, over here is like the subclavian vein, axillary artery, and part of the brachial plexus. And then over here, if there is fracture, then what you do, you simply put the sling, arm sling, and so that it does not move, the clavicle would heal by itself. Otherwise, if it is too much needed, then you can put the figure 8 bandage over here from that, but the simple hand arm sling is sufficient for it. This is all about the clavicle or collarbone, and I hope it will be clear to you. Thank you very much.